Hi, Lyra. Thanks for sharing your wisdom with us. Can you share an experiment that has shown the link of coaching and changes in the brain? It would be great to have some examples. Well, who better to talk to than you?
Yeah. Well, first involved in this journey of neuroscientific research, I also thought how actually coaching changed the brain. But actually what I found, sometimes you doesn't have to change your brain. You just have to activate or alter or stimulate the brain in several seconds or milliseconds. And that moment, that millisecond activations change us a lot, even though it doesn't really change, So it's not only changing the brain, but also activating the brain in certain way. One of the research that we do is actually in the area of health coaching. When we coach diabetic patients, chronic diabetic patients, or there are two studies actually, first 6 months, and then the second is 3 months. In the first research, we found that after coaching, the diabetic marker drops significantly compared to the control group. The patients who are not being coached, even though they have the same doctors, the same medical treatment, the same training about diabetes, right? And then we did the second research, and then we involved neurotechnology. We measure the brain before and after 3 months coaching. The hypothesis is when you coach a person and then they change their behavior. And because they change their behavior and lifestyle, because it is diabetic type 2, so diabetic that is related with a lifestyle. And when they change the lifestyle, so their glucose level will be normal, right? Or better, okay? But in our research, it is found that the diet, the sport, physical activities doesn't really change that much. The behavior that we thought relates to the diabetic market doesn't really change that much, but the patients are being pushed, drop their glucose level significantly, and also in a more sustained way than all the control group. So what happened actually in their brain, right? Because the difference is only coaching, okay? And then they don't even change their behavior. They don't really change their lifestyle, right? The calorie intake is more or less the same, okay? So what happened? And then we engaged in second studies. We use EEG to measure pre and post brain changes. And what really amazed us is that there's significant change in two associated construct or variables. First is emotions, and second is the frontal part of the brain. So the first is emotions. What is really, really changed? Actually, the intensity as well as the frequency of two emotions, sadness and anger. Not other emotions, not fear, not even joy. Are they becoming more enjoyable? No. But their sadness increased, their anger decreased, and that actually is translated into the brain, their brain activations. So the trace of this shift of emotions is also aligned with the change in the frontal part of the brain, how they work. Okay, so it is very interesting to find out that the anger circuit is less activated for those who were coached. The sadness is less activated. Okay, and it's just completely opposite with the control group, the diabetic patients who didn't receive coaching. Their anger circuits are much more active than 3 months, and then sadness keep the same, and then their intensity in terms of anger and sadness increase in terms of self-reported, emotions. I really want to explore more whether certain emotions relate with certain chronic the disease or something, right?
Yeah. Wow, that's really interesting. Thank you for sharing that with us. So my confirmation bias, of course, kicks in here and says, "Aha, yes, I knew it." In a sense that if we are slaves to our emotions, that leads to us not being really in control, and it leads to us not having the best life we could have. Whereas if we take a step back and we have ourselves be coached and we ask questions, we step outside of ourselves, we kind of look at ourselves, that sort of thing, that helps, put in a circuit breaker, calm things down. And that ultimately, again, has physiological implications, right? That because if we have less intensity of like so angry, then yeah, it's like releasing the handbrake when you're driving your car. It's like there's just not so much friction.
Yeah.
Sorry,
And then
my totally unscientific interpretation of what you just said.
Yeah, and then actually, I'm still analyzing the data. We do it, not for diabetic patients, the same techniques and coaching tools to leaders to find what is exactly that relates with that kind of the other parameters, perspective about life. Again, we have kind of parameters, and then in this study, it turns out that even we don't have to wait until our brain changed after several sessions of coaching. Even from one session, and even our brain hasn't really changed significantly post-coaching, okay? But there's certain moment, even that's only several seconds, not even minutes, several seconds. In that moment, when you induce certain activations in the brains of our clients, it can really change the way they see the life. Take a moment. It is actually not realized by the coach itself. You cannot detect that from what they say.
Right, because they're not aware of it yet.
Yeah, they're not even aware of it. But that moment actually, that relates significantly with how they see themselves, how they see the life.
That I find is so motivating for me as a coach, knowing that just one question that I ask could potentially help somebody find new insights. And it doesn't mean that I have to ask like perfect questions 10 times in a row. It means I can throw some things at the wall and I can ask certain questions. And if there's anything in there that really works because of some magic of the moment, then that might already be enough. And whether I feel like I've done a good job or the client feels that I've done a good job, we can't even be the judges of that because something might have been in there, right? And it inspires trust in me in a way, just inspiring trust in the coaching, in the process, in trying things out and being adventurous, like we were saying earlier, to explore and just see. And this idea that it just takes several seconds, that we don't have to train the brain like a muscle for months and months and months, but that just finding certain perspectives in certain areas, if that just gets a little bit more attention, then massive improvements can already happen.
Yeah.
Nice. Wow, you're making my day today. That is wonderful information.